Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Kim Downey. She's a physical therapist, and her Kevin MD article is titled An Inspiring Tribute to an Exceptional Radiologist Who Made a Lasting Impact. Kim, welcome to the show.
Thank you.
So we'll get into your article in a little bit, but first off, briefly share your story and journey to where you are today.
Sure. I feel like I have to share a little bit of my recent medical history because that is what brought me here today. So in November 2020, I had surgery for thyroid cancer. And during the surgery, 3 of my parathyroids were inadvertently removed and the 4th one never kicked in. And that caused some problems with calcium regulation and kidney function. And I was referred to nephrology. And I was put on additional medications. And during the summer of 2021, I wanted to reduce the medication. So my nephrologist was working with me and I blacked out and fell and hit my head. And in retrospect, they think it was low calcium caused a cardiac arrhythmia.
Sure.
And over the next 2 months, I had a brand new primary care doctor and my nephrologist and physical therapist figured out that I had Lyme disease, a concussion, thoracic outlet syndrome, a whiplash injury, and a broken toe. They were all excellent clinicians. And I went through 4 months of physical therapy for some neck issues and dizziness related to those issues. And I was in good shape by December 29th. My PT discharged me. But the very next day, I was back on the operating table because during that month of December, we discovered I had breast cancer. So on the December 29th, after I left my physical therapist's office, I drove straight an hour to the hospital where the surgery was going to be performed the next day for the insertion of a magnetic clip. And that was the day that I met my irreplaceable radiologist.
All right. Well, tell us the next part of your story, which you wrote in your Kevin MD article, an inspiring tribute to an exceptional radiologist who made a lasting impact. Now, tell us the next part of the story and how did your article come together?
Sure. So as far as the things I'd like to share about the article, promoting physician well-being has recently become my life's purpose. Having someone acknowledge that your work is valuable and that you're appreciated can have a positive impact on anyone's well-being, and physicians are no exception. And patient gratitude is part of my mission, and I've made it a point to let my physicians know how much I appreciate what they do and their commitment to their patients, despite all the burdens that they face practicing medicine today. And my article is a tribute to Dr. Sferlazza, who is my irreplaceable radiologist, because I feel that radiologists are unsung heroes of cancer treatment. And I felt the need to draw attention to how important Dr. Sferlazza was to my physician team.
All right. So tell us, how did your radiologist impact your care?
Well, he was really incredible. So I guess I'll just try to say the couple things when he performed like a couple miraculous feats of technical skill on me. So that first day when I went in December, what I hadn't really been thinking about at the time, because I just found out I had breast cancer, I wasn't thinking about these technical aspects, was that the tumor had only been visible on MRI. I had a mammogram and ultrasound and it wasn't seen. And it had only been 9 millimeters to start with, and 7 millimeters was removed during the biopsy. But then when she tried to get the metal clip in as close to the site as she could, somehow it got displaced that day. So it was pretty far off. So what I wasn't thinking about when I went for this magnetic clip insertion was how was he going to figure out how to get it in the right spot, right? So, because we didn't have an MRI. So the tech had me do like 15 mammogram images, right?
Yeah.
And she had me do everything but hang by my toes. I went to the left, I went to the right, I fell into the machine. So finally she said he wants to see if he can visualize it by ultrasound. So anyway, in the end, he thought he got it. And then my surgery was a success. And when my surgeon came in the week after, he seemed so pleased and relieved that he got clear margins. And I guess I never thought I thought you could see cancer. I didn't realize that you couldn't see it. But he had said that there was no way that Dr. Sferlazza could have ever visualized those 2 millimeters of cancer. So it was his high degree of skill, and intuition and experience that he must have seen the shadow where the tissue had been displaced during the biopsy site a few weeks before that. So my surgery was a success because he just got that magnetic clip exactly where it needed to be. There was only, the 2 millimeters of the cancer left. And because I have an excellent surgeon as well. So being a healthcare professional myself, I could understand, medical things, and I
Hmm.
fully appreciated that. And I sent them thank you notes. And then I went through a course of radiation. And then, unfortunately, the month after radiation, I needed another MRI because actually in December, there had been something visualized on either side. But the day of the biopsy, she couldn't see the one on the left. So I had another MRI. And then, unfortunately, that one was cancer as well. So I had to do it all over again. So when I went on June 1st for Dr. Sferlazza to insert the clip on the other side, he was just really nice. Like he stood at the door and he gave me a look and said my name, and I said, I don't really want to do all this all over again. And he was like, you need a hug, and
Mm.
this is the times of COVID. We're all wearing a mask. And my first thought was, is he allowed to do that? It's COVID.
Yeah.
But then I was thinking that he just thought, this poor woman needs a hug. And so he just gave me a hug, and then he got the mag seat in, and then he called me over and he says, you got to come see this. This never happens. And I was like, what now? Because I've only told you the bare minimum of what's happened to me the last 2 years. Like, it's only a fraction what I've already told you. So I was like, what could it be now? So then he showed me, he goes, I had to look at a few angles to make
Hmm.
sure, because he couldn't believe what he was seeing, but he had gotten the magnetic clip to pierce the metal clip, and they're both really tiny. So after the first surgery, my surgeon had said it was like looking for a needle in a haystack, and that's what Dr. Sferlazza found. And then this time after the surgery, my surgeon said it was like threading a needle when you can't even see the needle. So he just had such a high level of skill. But that day I left, I didn't know that that was the last time I would ever see him. So
So it sounds like Dr. Sferlazza technically was excellent, but tell me about that personal interaction that you had with him. You told that little story about how he gave you a hug. What did that personal interaction, talking to him, what did that mean to you?
Well, a lot. It was just at every turn he was kind, because even before that, what's not in the article, because I couldn't tell the whole thing, was he knew when I needed the other MRI. Well, and then when it was, he called, he let the surgeon call first. And then the next day he called me to see if I had any further questions. And he knew I wanted to do, because then I also needed the biopsy and the mammogram and ultrasound to see if they could see it other ways. And he knew I wanted to do it, but he called to tell me that he was going to be on vacation the next week. And if I wanted, I could wait till he get back. So I thought that was really nice of him.
Hmm.
But my surgeon didn't want me to wait because I was going on a trip as well. And then even before he was done, he like drew a circle around it with like a Sharpie, the area, and he put a piece of tape over it. And he said, this is just a little something extra I do to help him out. So for the surgeon, so he knows exactly where to put the magnet. So, and then before I left, he was, and he said, you need another hug. Like,
Hmm.
so that he knew this was hard and a lot, and that he just did at every turn, he was just as kind as he could be. And then afterwards, when I sent him and my surgeon another round of thank you notes, because they got, clear margins again and a successful surgery, and he called me to thank me for his thank you note. And he was just incredible.
So you mentioned earlier that as part of your journey, you now focus on clinician well-being. So tell me about that pivot point. What about your journey made you focus specifically on the well-being of physicians?
Sure. So, well, actually, I came across your site around February, March of last year. And I had already sent my physicians thank you notes, because now that I need a team of physicians, and I've seen like 33 in the last 2 years, even if it was one test or procedure. So I've had all kinds of experiences from wonderful to not so much, which made me appreciate the ones who had a positive impact on me even more. And I wanted to make sure they felt appreciated. So I had sent them all thank you notes. And then when I started following all your article, I've read every one for
Mhm.
over the past year.
Oh, thank you.
And and a lot of them were related to burnout and things like that. So then that became more and more of a concern of mine. So I reached out to my large local healthcare system to see how I could help. And they had given me a suggestion, but then it wasn't really followed up on their part at that time. So then I reached out again this January, because then yeah, after I had the surgery, because then I had to have radiation again and everything. So I reached out again and I said, I have to do something to make a difference. So I've
Mhm.
tried, I've spoken with our chief physician executive. We have new chief wellness officers. I've spoken with them. But then I've also, this is a story for another day, but I have a physician coach now who you're familiar with, and he's really helped me. And then I've been reaching out to physicians around the country from your, actually all from your articles. If
Mm.
they write something that resonates with me, I've been reaching out, and there's a great, team of doctors who have been helping me and giving me ideas and suggestions.
Well, that's wonderful to hear. And as a physician, oftentimes we only hear from patients when something goes wrong, when there's like a negative interaction. So hearing gratitude and hearing these notes of thanks really, really means a lot to pretty much every physician that I talk to. What do you recommend for other patients if they wanted to do something similar to what you're doing in terms of showing gratitude to the healthcare team? What are some things that other patients can do?
Well, and I've actually shared it on our town's Facebook page, and I've told people to, like, on Doctor's Day or really anytime, if you have a doctor or clinician or even other clinician, even if it's a dental hygienist, I wrote my dental hygienist to thank and she said it like made her month.
Right.
So anyway, so just when you're there, let them know that you appreciate them, that you're not taking them for granted, and that they can send, thank you notes as well, and do your own part not to overburden the system, not calling with needless questions and things like that.
So you went into this earlier. Tell us some of the responses you receive when you've given notes of gratitude or writing some thank you notes to your healthcare team. Just express some of the reaction that you receive when they
Sure.
receive your
Well,
notes.
sure. So though my initial radiologist before I had Dr. Sferlazza, I let her know that Dr. Sferlazza and my surgeon both thought she did a good job of identifying both the cancers at such an early stage. And I thanked her, and I said I knew that she did her best. And she said things like, thank you so much, exactly what you said, that we only hear about the bad
Mhm.
things. She said some people don't even know we're doctors. And that's why when I reached out to the community and said, send people, send doctors thank you notes, I said, even especially like radiologists or anesthesiologists, because I've also had a great one of those. I could tell you a story about another day. And they seem to be, people might think of their primary care doctor or their surgeon, but some of those other doctors you don't think of. But a couple doctors have actually called me to thank me for my thank you notes, or when I've seen them in person, they've just said that they really appreciated it.
We're talking to Kim Downey. She's a physical therapist. Her Kevin MD article is titled An Inspiring Tribute to an Exceptional Radiologist Who Made a Lasting Impact. So you talked a lot about Dr. Sherlaza, your radiologist. Tell us how you would like us to remember him for those who didn't know him.
Sure. Thanks. So Dr. Sferlazza was an incredible doctor and an incredible person. He had many talents, including photography and creating beautiful paintings and drawings throughout his life. From what I understand, he also loved music and dancing and ice cream. And as his wife told me, people need to know what a great, caring radiologist he was. So I want to thank you, Kevin, very much for giving me the opportunity to get this story out and honor the life of this wonderful man so that others can know the gift he was to so many. And so my other takeaway message would be that I hope we can all work together to discover ways to make changes in the healthcare system that improves the experience for both doctors and patients. And if you're part of a healthcare system that's had any success at all, please write about it and send your articles to Kevin MD so we can all learn from what's actually working.
Oh, thank you so much. And let me end by sharing a paragraph from Dr. Sherlaza's memorial. Quote, he had an intuitive gift as a physician in diagnosing and managing breast cancer. His expertise helped countless patients, and he was deeply appreciated by those he cared for. He felt an enormous sense of gratitude to be able to help his patients and be an integral part of their care. Kim, thank you so much for sharing his story, your time and insight. Thanks again for being on the show.
Thank you very much, Kevin. You take care.